Fellow St. Lucians, June 22nd to 28th, 2014 has been designated Vector Awareness Week in St. Lucia. The theme for the initiative is Beat the Bite, a nation coming together to fight vector-borne diseases. The aim is to focus attention on diseases, vectors, and the illnesses they transmit, such as dengue fever, leptospirosis, and chikungunya. Over the years, St. Lucia has faced several challenges from vector-borne diseases. In the more recent past, we have experienced epidemics such as dengue fever, the last major outbreak being in 2010 to 2011, following the passage of Hurricane Thomas. Similarly, cases of leptospirosis have been an annual occurrence, and the disease is now considered to be endemic to St. Lucia. These two diseases, dengue fever, which is spread by the Aedes aegypti mosquito, and leptospirosis, spread by rats and mice, have demonstrated a seasonal pattern with increases in the number of cases with the onset of the rainy season. This year, in addition to the aforementioned diseases, our population is now faced with the threat of chikungunya fever for the first time. The disease is caused by a virus and spread by the Aedes aegypti mosquito, the same vector for dengue fever. You will no doubt recall that the Aedes aegypti mosquito bears white bands on the legs, bites during late afternoon to early morning, and lays eggs primarily in clear, non-flowing water in and around houses. For this year, my ministry has recorded 30 confirmed cases of chikungunya and 256 suspected cases. We are, however, aware that this may represent a proportion of all the cases given the nature of a chikungunya outbreak in a population which has not been exposed to the disease before. With the emergence of chikungunya in the Caribbean in December 2013, my ministry has pursued a four-pronged approach to combat the disease. This included the following. 1. Training and preparation of personnel within the public health sector with respect to management of the disease. 2. Strengthening surveillance to monitor the disease as well as the distribution and density of the vector. 3. Strengthening systems for communication and awareness with a view to empowering the population to protect themselves, their households, and their communities. And 4. Applying direct mosquito control measures through the fogging operations of the Department of Environmental Health. It is important for all St. Lucians to be aware of these diseases because of the impact that they can have on their health and development. For example, complications from dengue fever can result in severe illness and even death. Leptospirosis, although treatable, can be fatal under certain circumstances. And chikungunya, although not usually fatal, can cause a degree of disability resulting in loss of productivity. This year, our concern is heightened by the possibility of both dengue fever and chikungunya fever cases occurring in the population during the rainy season. It is anticipated that during Vector Awareness Week and beyond, our entire nation will take time to focus on the issue of vectors in our communities, as well as our collective and individual responsibilities in reducing those conditions that are associated with their proliferation. I must admit that I have been quite heartened by the response thus far from several communities where cleanup initiatives were enthusiastically supported. I implore you to continue with the cleanup campaigns and other source reduction measures. In addition, other groups have initiated educational sessions for their members and clients. This is highly commendable, and my ministry applauds your efforts. It is only with such a collaborative response can control measures be successful. It is worth reiterating the simple message that we can take action to control vectors in our communities. The action that I speak of is simple. Cover all water containers that is intended for use. Clean your premises of unwanted items that may collect water and ensure that your drains and house guttering are free-flowing. Use soil instead of water in flower pots and vases. Use the services offered by the St. Lucia Solid Waste Management Authority to dispose of all items of solid waste. Be your brother's keeper. Be vigilant and encourage your friends and neighbors to take action to control vectors and reduce the threat of vector-borne disease transmission. I also wish to encourage those of you who may be interested in initiating cleanup activities within your community. Get organized and join the fight against vector-borne diseases. Contact the Department of Environmental Health at 468-3700 or the Bureau of Health Promotion at 468-5349, where you will receive support with your initiatives. Mwen ka invite tout moun ki ka weste ici Saint-Lucie pour participer en activité pour matcher simen vecteur qui ka commencer lundi 23 juin. Vecteur c'est animaux et vermine comme maïgouin, wat, exoui qui ka ane cause maladie comme la fièvre dengue, leptospirosis, et récemment, nous avons 9 qui l'ont mis chikungunya. Ministre Santé, a fait un grand effort pour gommer contre ces maladies là et puis ressources nous. Mais bataille là, kay plus fort. Let tout le monde jouer rôle yo et point casson ça là. Bien couvert tout contenant et bedroom qui ka chebe de l'eau. Fait assurer en dedans et puis dehors caillou, pas ni pièce bagay qui ka pêcher de l'eau couille sans gênement. Particulièrement canal et gouttier. Servite pito glo en ces pot flair. Couiller pour service autorité et management zodi, le ou vle jeter machine et l'autre appliance ou pas kay servi encore. En nous supporter yon a l'autre. En nous parler et puis voisine nous et puis camarade nous pour faire wol yo pour empêcher maladie par vecteur, si mais et détruire nous-mêmes. Changer, cette liste, c'est ça nous toutes. In conclusion, I wish to acknowledge the contributions and efforts of all persons, non-governmental organizations, including private sector entities, as well as governmental organizations that have, in one way or another, contributed to this national response. With your continued support, I have no doubt that we can beat the threat from vector-borne diseases. I thank you.